Okay, hello everyone. Welcome to another webinar from the Steps Forward Innovation Academy. Today's topic is Reimagining Value-Based Care, how technology is transforming data collaboration. We'll explore how cutting-edge technologies like augmented intelligence, cloud platforms, and advanced analytics are transforming data sharing in VBC arrangements. Please note this webinar is for informational purposes only and is believed to be current and accurate at the time of posting. Please consult a professional advisor for specific medical, legal, financial, or other advice. References and links to third parties do not constitute endorsement or warranty by the AMA. And let's just take a moment to go over your experience today as an attendee. If you are joining us on Zoom, you will see a dark menu bar either at the bottom or the top of your window. There you can access a selection of resources related to our webinar today, including the slides, our resource on behavioral health opportunities and value-based care as well. If you do not see either of these options, select the three-dot more button to access those resources. If you're joining us on YouTube or LinkedIn, welcome. You can follow the link in the description to join us here on Zoom and access the resources and ask questions to our speakers. Once the event concludes, you will be presented with a brief 2-question survey. Please take a few seconds to give us your feedback as it helps us tailor our programming choices to your wants and needs. After our webinar concludes today, you will be able to claim 0.75 continuing medical education credit hours. You can follow the link in the Resources tab to the AMA EdHub and claim the credit there. Also in the resources, you'll find a link to our upcoming webinars. You can check out the programming we have planned for the rest of the year and register there in one step. I'll remind you of all of this at the end of our webinar, but for now, I'd like to pass it over to our moderator today, Chris Botts. Chris, take it away.
Thanks so much, Alec, and welcome everybody. Today we'll be discussing how technology solutions are shaping and reshaping the data-centric environment of effective and sustainable value-based care. I'd like to welcome 2 physician leaders who are adapting innovative data sharing strategies and technology solutions in support of their organization's value-based care efforts and ultimately the care for patients they serve in their communities. First, we have Dr. Jan Boylston, who is primary care pediatrician at Burlington Pediatrics, Mebane Pediatrics, located in Alamance County, North Carolina. She also leads her practice's care transformation team, founding and overseeing the integrated behavioral health, care management, medical nutrition, and school-based telehealth programs. Next, we have Dr. Richard McCarthy, who is a neurologist and executive medical director for the Mid-Atlantic Permanente Medical Group, where he oversees nearly 800,000 Kaiser Permanente beneficiary members in the DC, Maryland, and Virginia region. Slide. Our goals for today are threefold. First, we'll be highlighting the importance of data and data sharing in value-based care, particularly around usable and timely data. We'll also identify the role that technologies can play at various levels of healthcare organizations. And lastly, consider strategies for improving collaboration and data sharing towards better clinical outcomes, more efficient care, and less physician burnout. Before we get started, I wanted to highlight several of AMA's resources that help address the challenges and opportunities of data sharing and value-based care. First is a playbook here on the screen of best practices developed in collaboration between the AMA, AHIP, and the National Association of ACOs, or NACOs. This is meant to provide a framework for data sharing and value-based care, enabling voluntary best practices to adopt principles and practices, along with improving existing data systems to better enable sustainable adoption of value-based care. The book includes inputs from results of both an environmental scan, interviews, as well as guidance from a diverse set of subject matter experts from across different value-based care entities, including folks like Dr. Boylston. In the book, we identified 5 major findings within 5 specific domains, including creating an interoperable data ecosystem, sharing more complete data, improving data collection and use to support targeted initiatives, sharing timely and actionable data, And lastly, transparency around how they're calculated, methodologies, and the context with which the data is shared, which I'm sure we'll get into more during the discussion today. I wanted to share from the playbook this maturity model, which shows how to conceptualize bringing certain data functions closer to a desired state, leveraging key enablers such as key technologies, as well as enhanced data analytics. Lastly, just wanted to highlight a few of the common themes of the best practices from the playbook, which highlight, again, topics I'm sure we'll cover in our discussion today, ranging from data privacy and security concerns, the difficulty of just navigating data given the lack of data standardization for many of the data that's being exchanged, along with challenges stemming from infrastructure capabilities, as well as the underlying financial investments needed to both invest and maintain that infrastructure over time. And lastly, we have this additional resource that we recently published that provides a guide for healthcare organizations as they evaluate their own technology needs. And it includes several key considerations and recommended strategic approaches to evaluating both internal options as well as potential external vendor partnerships, considering things like large capital investments and how it fits within the culture, integration with current systems, as well as how it aligns for overarching goals within your value-based care arrangements moving forward. If you could pull the slides down, actually, Alec, that would be great. Excellent. Well, now it's time to move into the meat of our discussion today. And we have an initial set of just questions that we're going to use to guide our conversation. But we really welcome folks that are attendants in this session to please submit questions that you may have using the Q&A button that Alec had mentioned at the beginning of the session. And we'll try to get to as many questions as possible during the time we have today. But to first start us off, wanted to first give you each an opportunity to briefly describe your experiences with value-based care and how data plays a role within your organization's success in these types of arrangements. So Dr. Boylston, why don't we start with you?
Sure. Thank you, Chris, and thank you for the opportunity to be here. I just want to wish everyone a happy Veterans Day, and to all of our veterans, thank you for your service. We honor you. As a partner in a moderate-sized pediatric medical practice, we don't want to miss the boat, and we want to try our best. And I think that that voice is always really important because in healthcare, you want to move everybody up and lift all boats. It's not just for select few, and especially with primary care, we're the ones that I feel equipped with the right support. We can do this well, and so we're a great example. We try our best, and some things we have to be really innovative with. And I think that the data reporting requirements for a lot of our participating, our payer agreements are a really good example of that. Advocacy is probably the most important thing that we do. We show up to meetings, we're vocal, we really sit and try to engage in those conversations, because sometimes, when we're given, oh, these are the requirements, it seems like, at least for some of our partner organizations, they just assume just unlimited resources in terms of data infrastructure. And so we're kind of that sobering voice to communicate that, hey, these are the capabilities and these are the constraints. And part of the way that we do that is really understand the ask of what your partner wants from the data. And so a great example of that is, one of our payment agreements, we were asked for a very complicated data exchange system, and we went straight to the source for what is required. For us in the state of North Carolina, go look at the data specs provided by North Carolina DHHS. And so when we were able to bring that to the table, that we understand that's your interpretation, but to us, it seems that we could actually give you exactly what's required in 5 separate files that are much less complicated, that we can run as SQL reports. through our EHR. And, and when you come to that agreement that was acceptable because they were getting what they wanted, maybe not necessarily exactly what they wanted, but they were getting the required documents and in compliance. And so, those are the ways that that we've navigated some of the difficulties that, maybe things aren't as insurmountable. And then I think the other parts that are really important are you have to find your own support team that when you are a smaller practice, for us, our local AHEC has been a really great partner. They're, part of our DHHS and practice support teams. And so really giving the call outs that these are the things that are required. We're not exactly sure how to navigate that. Can you at least put us in touch with other practices that may be doing this work that we're not exactly, aware of? I think with all of this, the other, just like the ether around all of this is the data security issue that when you're small, we don't have like this robust IT department that's going to take care of everything. We don't have like a compliance department that's working out the BAAs with all the small vendors or other firms that you're kind of required to work with as contingencies of some of these agreements. And so sometimes you just have to be really scrappy. And some of the ways that we've really approached that is, we would like in writing that we are required to use this vendor because according to the BAA, it's, that we are fully liable for any compliance or HIPAA violations that happen, and be prepared to ask, that we or our representative would like audit rights to your security protocols, because if we're taking the risk, then we want to make sure that we ensure some of those safety mechanisms that we will be accountable for what we understand and know, but the current agreement does not allow for that. And I'd like to put up the alternative payment model framework for a moment, if we're able. I think we all speak the language of value-based care, but admittedly, I actually, didn't even see this framework or visual until that recently, and it just started to make a lot of sense. And so just for our audience members out there, this is the Healthcare Payment Learning and Action Network, which provides such good resources and just really a lot of our national thought leaders on value-based payments have come together to create this. And this is the framework by which, I would say most, APM payments, value-based care payments are designed. And so kind of understanding where your organization is, for us, many practices are still in category 1, just fee for service without any link to quality. And if you're like our practice, we dabble in kind of 2. We have, programs in 2C. We are about to launch into 3B, which is the downside risk coming into next year. And the requirements and the terms of agreement are all different based on that spectrum of where you are in the APM framework. And I know that a goal nationally is to really nudge and support organizations to move and payment structures to move into the 3B, which is the downside risk, well into category 4. Just like my colleague Dr. McCarthy, Kaiser wrote the book on population health, and so they're very much advanced down the other way. But really, the system has to allow for that broad range of capabilities and payment structures that are in place.
Love it. Well, you touched on, I think, a lot of great topics, both in terms of just seeking reasonable solutions, right, in partnership, but also understanding your own capabilities, what your goals are, where you are, right, in terms of that value-based care spectrum as well, and that will change, but also understanding the continued kind of evolution of those needs as well as you continue to evolve your strategies. So we'll definitely dive into several of those aspects. But Dr. McCarthy, I want to give you a chance to provide some background information as well.
Great, thanks, Chris. Yeah, so KP is a category 4, and just so you understand how we're organized, there's Kaiser Foundation Health Plan, which is a national health insurance company that contracts with independent multi-specialty groups, one of which is the Mid-Atlantic Permanente Medical Group, which I lead in the Mid-Atlantic, and we are fully capitated, I guess, in this category for population-based management payment organizations. And for us, data is critical because we're paid based on outcomes. And I really appreciated Dr. Boylston's explanation of how things work outside with multiple payers. It seems a lot more complicated. We're lucky in that it's less complicated. We have a single payer. That's the Kaiser Foundation Health Plan. And the way we look at data is really surrounding adding value to a patient. And what we do is we look at operational data related to patient experience, physician and staff experience, quality outcomes as the numerator, and then total cost of care as the denominator. And data is critically important for us. And so in our medical group, we have a large team of folks who specialize in analytics. And I think for us, what's really important is that the data we use for each part of our equation to provide the highest quality of care, the best experience both for patients and providers, and the lowest total cost of care is the vetting that we do with the folks doing the work to make sure that our data is operationally relevant. And so typically what we do is we look at market-based outcomes like Net Promoter Index, for example, for patient satisfaction, or intervals to be seen for both procedural and outpatient care. And then we create reports, and those reports are basically vetted with frontline physicians who are seeing patients to make sure that it passes the sniff test. Ideally, the key in success in getting great outcomes at a fixed price, which is what we're doing, is to really engage physicians and nurses in the data itself, and have them buy in to the validity of the information that's being received, and then work out processes where it's easy to do the right thing to get the right outcome. And I think the other thing that's critical in terms of using data to move value-based outcomes for patients is making sure that it's not used as a weapon. And so what we try to stress is that it matters what the outcome is, obviously, but what matters even more is the slope of improvement. Because I think if depending on how you approach data with caregivers, physicians, nurses, I think the worst thing you can do is make it such that they don't either trust the data or they don't feel like you as a leader are a partner in their improving care themselves for the patients that they serve. The other key, I think, in terms of tactics that drive value for patients is that the tactics have to be balanced. So a tactic that just focuses on the total cost of care is going to fail, and usually ultimately ends up increasing the cost of care. A tactic that just focuses on patient satisfaction is going to fail. A tactic that focuses on patient satisfaction, physician satisfaction, increased quality of care, and lowers the total cost of care are the tactics that really win. And our experience has been that the people that actually come up with those tactics are the people doing the work. Sadly, not people like me, as much as except when I'm seeing patients in neurology. So those are kind of our principles behind data. I think the key as an operational leader is to make sure that the folks who are interested, engaged in the data aren't just the chiefs, the managers, the physicians in chief, or myself, but the people actually doing the work. And I think that's the magic of operational leadership that really helps move better outcomes for patients, which is what we're all about.
Fantastic. Yeah, we talk a lot about trust, and often trust is talked about between external entities, right, for the organization, the payer partners. But I think trust and transparency is also really important between the organizations themselves, right? Be able to actually feel like that is information that's relevant, actionable, and usable, right? For those folks that are actually helping them do the things they want to do, to your point, make doing the right thing easier, right? And if it feels like a check the box measure or something else, it's really not going to move the needle and engage in the way that we're really trying to transform the way care is delivered in these types of arrangements. And mentioned a little bit or alluded to, data, platforms, tools, right? These are all enablers, right? But as underpinned by those folks that are doing the actual work. So have you found some of these platforms or tools that have actually been helpful in your ability to be able to either gather, access, or share data amongst your team or your partners, be able to be successful in these arrangements? Things including remote patient monitoring, wearables, patient-reported outcome type entities, anything in that realm that you all have found to be helpful in your efforts, Dr. McCarthy?
Yeah, we're big fans of remote data monitoring. We use it in an advanced care at home program. We use it for diabetes, hypertension, pregnancy, and they're incredibly useful. I think that the key is accessibility to physician practice. So, and I think Dr. Boylston was talking a little bit about this, in that the data is only useful if it's easily accessible to a busy clinician who can incorporate it into their incredibly busy day, seeing patients back to back. And so I think it's really critical that you're not collecting data that lies in some repository that physicians won't see at their own risk, actually. And trying to do and Dr. Boylston talked about this as well, do the hard work of embedding it within the tools that they already have to take care of patients. I think that the future of healthcare is care at home and remote monitoring and all that. I think that it offers real value, but only if it's accessible to the clinicians doing the work in a way that's reasonable for them to use it to improve care.
Dr. Boylston, obviously for pediatrics, that's a very unique population that has considerations, not just for the children and adolescents, but the families and caregivers. Have there been any kind of tools or platforms that have been really helpful for you all? And in addition, as you start thinking about potential investments or what to work for, how do you determine, do you leverage things that currently exist? Do you build on your own? Do you partner with an external vendor? How do you kind of go through that thought process as you're trying to evaluate, your dynamics within these kind of arrangements?
Great. Thank you, Chris. That's a great question. I would love to just make a little commentary on Dr. McCarthy's point about just the team and the engagement and how critical that is. Even when you have just an incredible, system and you have all the tools and the technology, a great example of that is risk adjustment coding and value-based care. That whether you're a premier, very large health system or an ACO or practice like mine, there are significant challenges in getting, RAF is discussed in every sphere, whether it's by a small medical practice or larger, and that's all done in claims and ICD-10 codes. And so, when even though you have all these support tools and billing systems, that it's got to be done at the provider level, at the point of engagement as it hits the claim. Those are the just rules of engagement. And so having a system where everyone understands the importance and that this is in service to continuing to promote great access to care. And this is truly for our patients, but it's also that we get paid fairly and acknowledged for the work we do. That I think that communication piece is really important. I think in terms of the things that are available, that the technology and the tools available for practices like ours, I would say that with kind of the advent and evolution of AI and all these other tools. I think there's been, and I hope this is true, that there's continued democratization of these tools. And a great example of that is, ambient listening scribe technology. And so, it's not just for the large systems on Epic. There are quite good platforms that even we use and we use widely, that we've adopted, that have really helped us capture documentation with like diagnoses recommendations. And so there are a lot of things that we've taken advantage of. Another great tool that helps with kind of point of care clinical decision making, like Open Evidence, is fantastic. That's a free platform. And so really helping to guide evidence-based practices that are updated, that you can deploy fairly quickly without having to go back and having to, let me look this up and I'll call you back later. So I think those things, systems like or products like that have been incredibly helpful and game changers. In terms of creating systems within our practice versus outsourcing, I think really that's just a lot of just math and just doing the calculation of at what point is it break even? Is it sustainable? Like if it's going to change in the next couple of years and you anticipate that it's going to look different, then maybe you hold off and you engage with a partner. I think for us, probably the more kind of pressing question is, do you go with a provider or a company that's kind of best in class now, or do you wait for your EHR to partner or provide? And so we've gotten burned a little bit saying, well, if the EHR provides it and then you realize it's actually not a great product, they just added it because they knew there was demand out there, but it's not fully baked. And so, but that requires different type of logistics because it doesn't integrate into your EHR. It does create other steps for you to be able to use it. Then you have front staff who are scheduling, opening up to, they need 2 screens to view everything, from your registration, platform, and then separately with your EHR. So it does add some complexity, and you have to decide, is it worth it? Are the benefits, do the benefits outweigh the cumbersome nature of this, and at some point, or is the financial stake, what you're hoping to get out of this, does that warrant just some of these added administrative burdens?
I know you all have mentioned a few times, right? Communication, workflow, all these things are really important when it comes to these data and technologies. So maybe you all could share a little bit about how do you all both engage your care teams, both to understand why this data, these platforms are important, right, to your success within value-based care, but also how do you translate and share that data so it is actionable, it feels useful, it works within the workflows, so it can be a benefit, not a burden, right, to what they're trying to do as they're, doing what they came into healthcare to do, which is to take care of their patients and not click through a bunch of other different kind of windows and other things. So I don't know, Dr. McCarthy, if you want to maybe start with how you all communicate with your frontline folks, how that works with your other partners, like your health plan or other payer partners, what's worked well, what hasn't, up to this point in time.
Yeah. So I think the key is when you're looking at performance data, make sure that it's iterated well in the beginning with the people doing the work. For example, we have performance dashboards for various specialties, and what we do is we engage the specialists or the primary care docs in what does excellent look like in your practice. Their engagement is mostly in terms of quality outcomes for their practice, but we also engage them in things like consumer experience in terms of experience, intervals to be seen, and various operational metrics and access. I think again, the key to success is making sure that you, when you're looking at data and operational metrics that matter that you're following, that you engage people, that they buy into the metric. 2, that you limit kind of the tendency to have too many metrics. It's better to have one metric for a particular operational outcome than lots of metrics. And I think that the key also is that you're allowing people to innovate around changes in process, changes in local tactics, and that you accept that it's okay to fail fast, and then try again. And secondly, that you have a kind of oversight function where you can identify best practices and share those readily. And I think it's you're never done. As I said, I think where you are in time and space is less important than your slope. And what you want to do is make sure that you're encouraging people to increase the slope of improvement, and that you're constantly iterating and encouraging people to engage in their practice and feel ownership. And that's why I think I mentioned previously about the danger of using data as a weapon, in that you're not going to create an innovative, action-oriented group that's moving the curve for patients in terms of value. You're going to create a defensive, kind of unhappy, probably already overburdened clinical staff. So that's kind of the magic of leadership. And I think, to Dr. Boylston's point, it has to feel seamless, right? Because, and I think a lot of the most exciting things, like ambient AI that was mentioned, is that it really puts all of the technical aspects of medical care a little bit in the backseat, so that patients can really focus on the relationship aspects and the attentional aspects of giving care to someone, that in some ways is as important, if not more important, than the technical part.
Dr. Boylston, would love your thoughts as well. Just a reminder for the audience that if you do have additional questions, please use the Q&A box, and we'll continue to work through them as best we can. But Dr. Boylston, any additional thoughts on that specific question?
Yeah, absolutely. I would just concur with Dr. McCarthy. I think, it's the slope that's important. And as we like to say, progress is not pretty. So I would add that on. It's, the slope, and then it can be messy and it's sweaty. And I think for us, being able to translate what that number means and how it impacts our team. So a great example is, recently one of our plans shared with us. I mean, what really we were so proud of, it was our ER visit rates per 1,000 patients compared to the benchmark for all advanced medical home 3 practices, and ours was over 30% less than that. And being able to say we are preventing the need to go to the emergency room because we are open and accessible 7 days a week. We have walk-in clinic. It's you answering the phone and triaging effectively and helping helping our families get into our clinic. That's you, front staff. That's you, the schedulers. That's you, triage nurses. That's you, the providers. If there is an ask, hey, can we get a person just walked in. It looks like you have an opening in your schedule. Can we accommodate that? And just really. It's got to be imbued with the mission. And what is the mission? It's we provide care to our community, and I think that that's something that if you understand that and you share that as part of the culture, then it feels natural to be able to say, yeah, I'm going to step up to this, but also celebrating the wins. I think the transparency and making sure that the data, that when you have things to celebrate, it doesn't stay compartmentalized. That's really disseminated out and translated so that people understand their role in achieving that. And then also it's that two-edged sword of, it can't be punitive, as we say, just praise publicly, criticize privately. And I think that's incredibly important, when you do have all this data, especially at the granular level, down to specific providers. And, and sometimes that's not situationally, there may be other variables that account for that, but understanding that how do we move everyone forward and continue to make progress.
Well, it wouldn't be a healthcare conversation. I know we've mentioned briefly AI a few times, but haven't explicitly kind of delved deep into that topic area. But, wanted to ask you all your thoughts about kind of emerging technologies. It's kind of weird to think about AI as emerging, considering how much conversation has been around that space. I know it talked a little bit about ambient AI, but just your all's thoughts about what types of emerging technologies, whether it's AI, enhanced predictive analytics, other elements that you will think will have the biggest impact on your all's value-based care efforts moving forward, and how do you make sure that those are positive in terms of your experiences and the users, right, to drive change rather than feeling like additional burdens in terms of the care that's trying to be delivered within your organizations. And I'll leave it up to you all, whoever would
Yeah,
like to start.
I can start. I know that there's a lot of exciting things happening in AI, and I think AI is going to transform physician practice in the realm of decision support. Give some examples. In the Mid Atlantic, we use AI to help second read for pathology and in radiology as well. I think there's also opportunities to for us, at least in terms of our patient secure messages that are sent to us electronically, to organize those and potentially edit responses or create responses that the physician can edit, that's similar to ambient AI for charting outpatient notes or surgical notes, that it enables physicians to edit and publish, both in terms of diagnostic work and also in terms of patient communications, and saves innumerable hours for busy docs. I think I'm really excited about AI, and I think it will definitely change the way physicians practice. I think the shared decision-making abilities, the EQ of physicians, is going to become increasingly important. Not that it isn't already important. And in some ways, not the IQ piece, but the logical piece, there'll be less burden there, and I think less, hopefully, administrative burden. So my hope with AI is that it will not only improve quality and safety, but also help improve the practice of medicine and get docs back to what really is soul enriching for them, which is the relationship aspect of the care they give. So I have great optimism for AI in the future. I think it's going to make our practice better.
I wholly concur, Dr. McCarthy. I think I'm so excited about what's to come, and I'm particularly excited about the generations of physicians who will train, and this is just part of their role. It's not new; it's just baked into what they do. I'm particularly excited about some of the things that are coming down the pike, including like predictive care coordination. I think the things that are just such pain points now that we're like, why can't we get a hold of this? Why is this so manual? Why does it take 3 phone calls to get this patient care? That hopefully, when everyone is sharing those unified systems, that ideally it just happens in such a seamless way. So I'm very excited about that. I do think that the mentality, or just the way it rolls out, it's got to be done in the right way. Physicians and healthcare, in general, should and is risk averse. And so how do you find that very safe space for innovation? And it's going to be just starting small and scaling and getting the kinks out, and then other people seeing the work and building confidence. But I think with you have the early adopters, and they can run with it, and then having support for the fast followers and the folks who do have some hesitation about this. And, we see it in all organizations, certainly doing something new. We saw that in my organization too, with the ambient scribes. And, when you provide that supportive environment, I think that's what helps everyone to be successful. I think the other thing that we need to be really scrutinizing of is the baked in biases in terms of, we have to be really discerning. And sometimes it's even more challenging to be a proofreader or a reviewer than to actually be the writer. Some of us who've written papers understand that. And I think just thinking critically about the systemic flaws or the algorithms that are being used to generate this output, I think that in and of itself should be a field, and it should be very robust. And we've got to look into that.
And the message matters, who's passing along the message matters, and when, right, are all really important. So even if you have some of that designed and help generating it, it still comes down to that engagement and that relationship, right, between the clinician and the patient, and that trust, right, that they're there to do the right things for them and figuring out a solution that works best for them. And that is, to Dr. McCarthy, your point, right, part of the reason why folks are wanting to get into medicine, and let's find ways to protect that time and allow them to do that appropriately. So I know we're running low on time, but I wanted to both, as we wind down, give you both a chance to highlight a couple actionable items for our listeners that they can take away to their organizations from this discussion and implement, now and into the future. So maybe Dr. Boylston, starting with you, and then Dr. McCarthy, we'll end the conversation with your closing thoughts.
Sure. I have a couple, because, just in my role, it's all about being practical. And I would say, number one, start with your pain point, because no one has urgency in fixing a problem that you don't have, right? But if you start with, the pain point, really think about what your organization, your experience, and what would improve things for you. So, if it's documentation, then maybe the first thing that you really look into is like the ambient scribe, right? Or if it's, gosh, the prior auths are terrible and my organization has such a hard time with like claims denials, then maybe you're looking for a back-end technology solution in terms of, all of this. And so just you gotta outline your problems first before you can find a solution. And when people are invested, there's urgency into solving that problem. I think the other key that's been really important for us is start small and scale. Because when you're a small organization, there's you have a lot to risk, and you can't go all in and decide that this wasn't this was a terrible idea, right? And so start small. The pilot may not look exactly the way that you want it to evolve, but at least you can get the kinks out, and it's a much more effective way. You can always add people to the boat, but it's really hard to push people out. So I think that's really important. And then I think the third important thing is we're not passive observers. We're all protagonists here. And so become the expert. If you don't know something, be an expert. So for me, I was really frustrated with why does our RAF score not reflect what our benchmark is? And so what I did? I went to ChatGPT and I said, list the top 40 ambulatory ICD-10s that contribute, that have the most impact to RAF. I didn't know this stuff. And so, just you're, stay curious and look. And then next thing you know, you're the person presenting to your provider team on how we can all contribute to this work, right?
Yeah, I agree with everything that Dr. Boylston said. Just to add a few other items, I think early on, really make sure that that you quality check the data that you're using, because there's nothing more demoralizing to people who are working really hard than finding out that the information you're giving them was in some way incorrect. And so really spending a lot of time early on doing QI on the data, getting feedback, having people poke holes in it, so that you do get local engagement. The other thing is, and the difficult thing, and Dr. Boylston described it in a lot of, I think, great detail, is that in what we're doing without data, we're all flying blind. And so really trying to, whatever you can do to get data to move operations, I think that's critically important. And lastly, even though it's really fun to solve problems, as leaders, make sure to remember that the best solutions come from people doing the work, not from you. And so your role is really, in some ways, to curate the best data for as Dr. Boylston said, the most relevant pain points for the team and or your customer, your patients, and then let them be free to find solutions, fail fast, or hopefully identify best practices. So those are my kind of final points, I guess.
And you all might have seen a pop up. Again, that's just part of our data feedback as we determine the utility of these webinars moving forward. So just appreciate everybody's responses to that. But just thank you all again for your time and expertise, and just this discussion I think was really great. And I think it was really amazing just to see both the commonalities, right? You all come from very different organizations, but I think there's a lot of core elements here that really span across settings that hopefully resonates with our audience members as well. So thank you all so much for your insights and time. And with that, I will pass it back over to Alec.
Thanks, Chris.
All right, folks. Thank you all so much. Let me just get your attendee controls up again so you can be reminded of everything that you all folks have access to today, excuse me. So thank you all for your time and expertise today. When we conclude, you will see our feedback survey. I know I just put up a poll. There is just one follow-up survey. Please take the time to answer the 2 questions there. Your responses will help guide our upcoming programming to deliver webinars you want to see, such as the one you saw today. This recording will be available to review on demand with the link used to join today, as well as on the AMA Ed Hub. Our next webinar will be on December 4th, our last of the year, titled From Height to Help, Putting Physicians at the Center of AI in Digital Health. A great follow-up if you enjoyed today's content. Our experts will discuss how to help cross-functional stakeholders, including developers, administrators, and decision makers, understand what physicians truly need to successfully interact with and trust digital innovations. You can register now by selecting the link in the Resources tab. And finally, if you're looking for something more in person to do with the AMA Steps Forward Innovation Academy, we would like to invite all attendees to consider joining us for our next Saving Time Practice Innovation Bootcamp in Chicago next April. This 2-day in-person bootcamp is specifically designed for clinical and operational change agents looking to eliminate unnecessary work and free up more time to focus on patient care. If you have interest in attending, you can follow the link in the Resources tab. For additional resources and guidance to support your physicians and staff, including those on value-based care, please visit the American Medical Association website or stepsforward.org. Thank you all again for joining us, and we hope to see you again very soon.
Thank you.